Most patients that end up coming to see a spine surgeon usually have had some issues for some time and are pretty informed and understand what's going on with them. Most spine problems usually get better on their own, which is the good news. And I would say 90% of the people I see in my office don't end up needing surgery. Most of the time, Mother Nature, the tincture of time, steroid injections, medications, and therapy take care of it, and the body heals itself. And then there's a smaller percentage of people that need a little help. At Brigham and Women's now, we are really treating patients with some of the most innovative procedures that you'll see, not just in the region, but in the United States and in the world. And what we can do now is get to the spinal canal through much less invasive approaches and very small incisions. Now we have techniques like microendoscopy, where we can use a small tube, a cannula with a camera in it, that allows us access to the spinal canal through an incision that's about a half an inch. And we can perform these procedures, take the pressure off the nerves, and it takes a few hours and patients go home. I think the thing patients are concerned about the most are the risks of surgery. And through microendoscopy and these other techniques, we have 10 years of data showing much lower complication rates and reoperation rates, and they're much safer options for patients. Now when I see patients after microendoscopic surgery, I see them at 2 weeks and it's like they had never had surgery. And it's really incredible to see that transformation. You know, someone who's incapacitated by nerve pain, like lying on the stretcher in the clinic and their preoperative visit, and then they just walk in like nothing ever happened to them. It's very rewarding. Brigham and Women's Hospital marries some of the world's experts in spine surgery with some of the most innovative techniques so that we can deliver people the kind of care that combines and marries expertise with the technology and surgical interventions that you won't see many other places for the next 5 or 10 years.